It is a great pleasure to welcome you to the 2018 edition of Clairvoyance, the signature conference of the School of Health System Studies at the Tata Institute of Social Sciences, Mumbai. In its 21st iteration this year, Clairvoyance serves as a platform for generating and showcasing fresh perspectives and ideas in healthcare and public health.
Accomplished professionals and ambitious students from medical, health and healthcare institutions across the country have joined us today to share knowledge and experience as well as participate in discussion and debate with the ultimate goal of charting a roadmap for constructive engagement geared towards truth, safety, sustainability and inclusivity in India's and world's health odyssey. We embark on this journey under the stewardship of experienced leaders from industry and academia, such as the Director of Institute, Professor Shalini Bharat, and our guest of honor, Mr. Sarvamitra Sharma. Now, I please request Professor Shalini Bharat to escort our esteemed guest of honor, Mr. Sarvamitra Sharma, to the dais. I request everyone to please stand up and give a standing round of ovation for our guest of honor.
I would now like to request the Dean of School of Health System Studies, Professor Anil Kumar, to escort our guests, Dr. Harish Nadkarni and Shri Keshavendra Kumar, to the dais. I request everyone to please give a huge round of applause. Now that everyone is settled, I would like to quickly apologize for the delay in beginning the session. I would request everyone to please stand now for the Institute song.
Shall I see?
We would now like to invite the Dean of the School of Health System Studies, Professor Anil Kumar. Professor Kumar has had an illustrious career at TIS over 25 years. He is a distinguished researcher and published author in the fields of demography, urban health, child and adolescent health, as well as in the study of migration. We would like to please request Professor Anil Kumar to come forth and kindly address this august gathering.
Dignitaries on the dais, our guest of honor, Mr. Saromitra Sharma, our chief guest, Sri Keshavendra Kumar and Dr. Harish Nadkarni, our director, Professor Shalini Bharat, distinguished invitees to the conference, resource persons, participants, dear faculty and staff colleagues, and my dear students. A very good morning to all of you. Indeed, it's a privilege to be here on the dais and give this welcome address as the Dean of the School of HSS, which is organizing this important conference on the health of disease. Not only that, it is also my privilege to be here, particularly since the actual work behind this conference has not been done by me, but other people. And I get to stand here and welcome you all. Before I get into my responsibility of actually welcoming you to the conference, let me also make one or two observations. This conference has an important, relevant, timely theme: engaging the stakeholders through dialogue in an attempt to unravel the health of disease. The key word in the title, in the theme, is dialogue, and contemporary dialogue, and not just discourses. A second observation is related to the sub-themes of the conference. The dialogue. Themes like health reporting and representation in the media, regulations in health sector, what they have achieved and what they have not achieved, revolutionary models in healthcare and health, women leaders in health, operationalizing strategy in hospitals are some of the very interesting themes. Some of these, while have gained some attention in earlier conferences, many of the conferences, some of them are rarely discussed. I am happy that they are being discussed at this conference. And I hope that these dialogues over the 2 days will help us to enhance our knowledge, as well as it will ultimately lead to appropriate actions to improve people's health. With these brief remarks, let me heartily welcome our guest of honor, Mr. Saromitra Sharma, Founder, Chairman, Chief Advisory, Pahal Group, and the advisor to the Board of Dainik Jagran. A warm welcome to you, sir. Let me heartily welcome our chief guest, Sri Keshavendra Kumar IAS, State Mission Director, NHM Kerala, who is also the Additional Secretary to OFISH Kerala. A very warm welcome to you. Our chief guest, Dr. Harish Nadkarni, He is the CEO of the National Accreditation Board for Hospitals and Healthcare Providers. A very hearty welcome to you. It might sound a little odd, but indeed it is my pleasure to welcome Dr. Shalini Bharat, our director, who has actually boldly agreed to take up the responsibility to be the director in the challenging times we are facing. A very warm welcome. With great pleasure, I warmly welcome all the speakers, judges of various competitions that are arranged as a part of the conference and conference participants. Warm welcome to all faculty colleagues and staff colleagues from the School of Health System Studies as well as from other schools. It is a pleasure to extend my sincere welcome to alumni of SHS, TISS to this important conference and the alumni meet scheduled for tomorrow. Before I take leave from this responsibility, let me welcome the first year master students from SHS and the students from other schools as well as MPhil PhD scholars to this important event. Finally, I wish to congratulate the second year master students who are the organizers of this conference. I congratulate them, the Clairvoyance Committee, the faculty coordinators and colleagues in making Clairvoyance 2018 a reality. I look forward to having dialogue with many of you during these 2 days and beyond. Once again, a warm welcome to you all. Thank you.
Thank you, sir, for the address. Now I would call upon Professor Shalini Bharat, the Director of Tata Institute of Social Sciences, Mumbai, and a professor in our own school, School of Health System Studies. She is also the Program Director for Saksham, a global fund-supported initiative that implements TB-HIV counseling program in Mumbai. Widely published in peer-reviewed journals, Professor Bharat also serves on several scientific advisory committees and technical review groups of many national and international organizations.
With a noteworthy career as a researcher, educator, leader, and mentor, Professor Bharat has worked tirelessly for the cause of furthering dialogue and encouraging collective work between stakeholders in the sphere of social and development work, and is deeply committed to the values of the Institute. Professor Bharat is an exemplary steward of young graduates entering the workforce, helping them reimagine futures for themselves and for society. We would like to cordially invite Professor Bharat to share a few words with our audience and guests.
Kind words, longish introduction. Thanks. Our esteemed guest of honor, Shri Sarvamitra Sharma ji, founder chairman of the Pahel initiative and advisor to the board of Dainik Jagran. Our chief guest, Dr. Harish Nadkarni, CEO, National Accreditation Board for Hospital and Healthcare Providers. Shri Keshwendra Kumar, State Mission Director, National Health Mission, Kerala State, and Secretary Ayush, Government of Kerala. Professor Anil Kumar, Dean of the School of Health System Studies. Professor Sivakami, Faculty Coordinator of Clairvoyance 2018. Distinguished guests and delegates in the audience, my faculty colleagues, dear students, and alumni if there are any today here. Good morning and a very warm welcome to all of you to the 21st edition of Clairvoyance, the annual conference of the School of Health System Studies of TISS. Over the past 2 decades and more, Clairvoyance has emerged as a keenly awaited event in the health sector space. It is widely recognized as an event which brings together key stakeholders who shape ideas, initiate and lead important debates, and influence India's health policy and programs. It is therefore quite apt that Clairvoyance 2018 has chosen the theme, The Health Odyssey, Engaging Stakeholders Through Dialogue. A well-performing, equitable, and robustly governed health system is at the heart of social advancement and overall growth and development of every nation. Like all other systems, The health system too is a complex structure with multiple stakeholders holding it aloft. It is well known that engaging with stakeholders is not only crucial but good practice for any complex system to deliver on its mission and objectives. And health stakeholders are not confined, as we know, to government and medical world alone, but spread out to include the academia, the civil society, the market, the corporate, legal, paralegal systems, the social workers, the counselors, the frontline health functionaries, and most importantly, the public at large in all its diversity. This would also include the various associations and networks like the ICMR, the ICSR, DPT, IMA, MCI, civil society groups, and many, many others. It is apparent that the health system involves networks of networks layered by state and central government organizations. By choosing this theme for this year's event, the organizing committee has thus challenged all of us to engage with this high level of complexity, in which the various structural factors like gender, class, caste add yet another level of complexity and dynamics. In the country's current health sector, the debates around ethics in medical practice, the growing mistrust of the society towards health professionals, the double burden of communicable and non-communicable diseases, and the lack of women leaders in sufficient numbers all emerge from this kind of complexity mentioned above and need urgent attention for remedial measures. Since its inception, Clairvoyance has been a largely student-driven activity, and even that brings forth the best among our students, and it is of course led by and guided by the faculty of the school. I congratulate the organizing team for putting together a very impressive program for all of us, and I hope this will be proved to be very successful by the enthusiastic participation of all those who are present here. I wish every success to this conference, and please enjoy the two-day conference and contribute to its success. Thank you very much.
Thank you, Professor Bharat, for those kind words. I would now like to request the guest of honor, Mr. Sharma, Professor Bharat, and the chief guests to please unveil Clairvoyance. We now proceed to remarks from chief guests, Shri Keshavendra Kumar IAS and Dr. Harish Nadkarni. Dr. Harish Nadkarni, the CEO of the National Accreditation Board for Hospitals and Healthcare Providers, NABH, which is the constituent board of the Quality Council of India, set up to establish and operate accreditation programs for healthcare organizations. With over 25 years of clinical experience as a gynecologist and obstetrician, Dr. Nadkarni also possesses quality management qualifications. He has been a lead assessor for ISO 9000, Six Sigma Black Belt, and has been trained in various methodologies of quality management. He has executed several projects with Six Sigma methodologies related to healthcare sector, service, and manufacturing sectors. As CEO of the NABH, Dr. Nadkarni's work has helped establish the organization as the apex national healthcare accreditation and quality improvement body, functioning at par with global benchmarks. We invite Dr. Nadkarni to kindly address his esteemed audience.
Thank you very much. I have a special talent. I bring programs back on time by the brevity of my speech. I don't have much chance of doing so when I am the first speaker. Thank you. I'd also given this speech for printout, and I thought everybody will have it and we can all read it silently, and I just say thank you at the end. But it does not seem to have happened. I don't see any papers there. So let me thank the organizers of this event for this honor by giving me opportunity to address this august audience of the young by age but not so young in their competence. With my salutations to the dignitaries today, I would like to address few points pertaining to the theme of this year's clairvoyance. Clairvoyance, as you know, is the faculty of perceiving things beyond the sensory perceptions and looking into future. Let's take a look at the healthcare system as it is within our sensory percept. Word healthcare, though refers to health, also refers indirectly to ability to work, ability to attend school, ability to produce economically profitable activity, prosperity, improvement in national competitiveness, and in simple terms, plain prosperity. Therefore, high quality healthcare system with appropriate financing mechanisms reduces incidences of catastrophic and impoverishing expenditures. Healthcare today in India is one of the most fragmented industries with various stakeholders going in different directions. There exists a vast gap between what is desired and even at its most basic level and what really exists. The dream of high quality healthcare is therefore far away. Approach over the years to begin with have been regulatory, intervention of judiciary, some voluntary initiatives to provide desirable healthcare services to the population of the country. Healthcare basically should not therefore discriminate by financial status, gender, geographic locations, etc. etc. I would like to highlight few of the approaches taken by main current government making it a priority. Launch of Prime Minister Jan Arogya Yojana, popularly known as Ayushman Bharat, and allied and healthcare professional bills passed this week are going to have major impact on healthcare scenarios in the country. All big initiatives appear small in the beginning but are likely to grow up hugely. Ayushman Bharat today, on today's date, has verified beneficiaries of 7.5 lakh, sanctioned pre-authorization amount of 400 crores and total claims submitted of more than 2 lakhs and settled. Among the registered HCOs, the private hospitals are about 15,000 plus, which is 27% of the total registered, and 14,000 out of these 15,000, 14,000 have self-registered without any push in this scheme, whereas there are 42,000 public hospitals, which forms about 73% of registered HCOs. UP has maximum, which is about 3,000. Bihar and Maharashtra came to about 1,600. Rest, Gujarat, etc. are about 1,000, whereas least being Andaman, Nicobar, Puducherry, Goa. 11% of these hospitals are NABH accredited or certified, and the government is giving them 10% incentive if they are certified to NABH and 15% if they are accredited. These incentives are also being looked into of what are justifiable or can they be increased by the government. Efforts in healthcare quality in India as systems approach started with implementation of ISO 9000 in late 90s. That was the only approach available to healthcare organizations, and NABH as an accreditation was initiated through the efforts of government. And it may be to your surprise that it was Ministry of Tourism which initiated, because of export of medical services was an important subject there, and it was thought that accreditation forms an important part of selling of services globally. And therefore NABH was created as a part of Board of Quality Council of India in May 2005 or 2006, and the first edition of the standard was launched in December 2006. It was under the able leadership of Girdhar Gyaniji, who was the Secretary General at that time. Over the years we have got many editions, and the current one being fourth one, it will be revised in 2020 as per our commitment to ISQA, which has accredited NABH as an internationally certified and forming to the global benchmarks. Over the years, NABH has grown from mere single-digit accredited organization, accrediting body, to current number, which is well over 700, and under the certification launch about 3 years ago, there are 4,000 applications under process. NABH today conducts more than 3,000 assessments in a year and intends to scale it up to more than 20,000 in next 1 year. A few initiatives we have already started. A question is put to me many times whether accreditation is whole of quality and should we stop there. Of course not. Accreditation forms one of the basis. It is like plinth or pile foundation. Unfortunately, this pile foundation is taken by organizations after they are up and running. That makes it extremely painful, no less than a surgery without anesthesia. One of the stakeholders in this is also the consultants, and we have started registering consultants for the first time through our sister boards NBQP and NABT, and intend to upgrade them so that they form one of the important stakeholders in improving healthcare quality over the years. That was one of the grey areas in the whole system, and it is being addressed now. Over the years, I hope that HCOs, which are currently restricting themselves to accreditation. Accreditation is like going to gymnasium and showing off your physique. You show off that certificate which has a marketing ability. It also has an impact on putting things in order. If you go through NABH clauses and standards, most of the things are what organizations should have been doing anyway, but was not doing. That makes it very painful to implement at the initial stage. Once put in the system, I have not seen any organization abandoning accreditation, because it really, they find that it is genuinely helpful in keeping things under control in the complex running of hospitals. Over the years, I feel that organization will progress to advanced quality management techniques. Some of you may be exposed to them currently, such as analytics, control charts, quality function deployment, right throughput yield concepts. Many of the new initiatives of data analytics using Bayesian statistics, predictive analysis, Mahalanobis-Taguchi systems, and among hardware, the Internet of Things is likely to have massive impact in decades to come on healthcare. Already statistical analysis of 1600 parameters is being done by Cigna in USA to have predictive healthcare and giving incentives and support to individuals to use various packages to reduce their healthcare risks in future based on their current parameters. Quality of healthcare has been addressed under various definitions and models. First one, as you all know, is Donabedian in 1966, which stated for the first time structure, process and output. This model itself made it clear that only structure is not going to get you where you want to go. So therefore, putting huge amounts of infrastructure cannot be expected to have automatic improvement in the outcome unless the way healthcare is addressed is looked into. Next was the approach of Committee of Quality of Healthcare of the Institute of Medicine in US, which defined quality as the degree to which healthcare services for individuals and populations increase the likelihood of desired health outcomes and are consistent with the current professional knowledge. It has 6 dimensions of quality, safety, effectiveness, patient-centric approach, timeliness, efficiency and equity. Equity lately has become a very important aspect in addition to patient safety of a parameter of quality. It was also noted by management experts such as Michael Porter that current healthcare system cannot support these achievements, and trying harder is not necessarily going to get better results. WHO also had defined integrated people-centric approach to health system, where people have equal access to quality of healthcare services that are composed in such a way that it meet their life care needs. All such systems aim at outcomes that include longer lives, better quality and improving capacity to function. It is a system which is importantly mentions that healthcare professionals also should not feel threatened while delivering the healthcare services, a point which has become lately quite important in our country. Coming years, hopefully we will see more integrated approach of healthcare through coordination among various agencies. The number of ministries that itself deal with healthcare will be surprising. If you know, there are at least 15 to 17 ministries which deal with some aspect of healthcare, including the railways. They have their own hospital. Ministry of Labour deals with ECHS, in addition to Ministry of course, Health and Family Welfare. Ministry of Chemicals and Fertilizers deals with drugs as well as medical equipment. To come back again, Ayushman Bharat, I feel, will address this task as an equalizer. It will also bring private healthcare units and public healthcare units on the same platform. So you cannot say that public healthcare is below par or not as desirable just because it is public system. It will be on par with both. Our country has provided healthcare professionals to the world. health system in every developed nation is ably supported by the medical and nursing professionals who have received their initial training in this country. I think it is time for us to provide the world with competent healthcare professionals, healthcare management professionals, and I hope that this task will be ably handled by the institutions such as yours. Thank you.
Thank you, Dr. Nadkarni, for the address. I would now like to call upon Shri Keshavendra Kumar to the podium. Shri Keshavendra Kumar is the State Mission Director of National Health Mission Kerala, as well as the State Mission Director of the National Ayush Mission. The youngest in his batch to be accepted into the Indian Administrative Services in 2008, he is a dynamic leader with popular and noteworthy stints as Director of Higher Secondary Education in Kerala and as District Collector of Wayanad District before his current appointment. Shri Kumar has been at the helm of several social welfare measures in his career, especially targeted towards tribal populations. We request Shri Keshavendra Kumar to kindly address the clairvoyance delegates.
Respected Director, it is Professor Salni Bharat. Dean, School of Health System Studies, it is Professor Anil Kumar. Shri Dr. Harish Nadkarni, CEO in a National Accreditation Board for Hospital and Healthcare Providers. Mr. Sarvamitra Sharma, Founder Chairman at Dainik Jagran Group. And my dear, I will say colleagues, because most of you will be working in health sector, in either in government sector or private sector in future. So at first I would like to thank organizers to invite me for this wonderful workshop, Clairvoyance 2018, the Health Odyssey, and even this topic, engaging stakeholders through contemporary dialogue, is very much relevant and all, because as we know, health sector is a dynamic sector. The things which we are seeing today, again tomorrow with changing times and all, again equations, parity, everything change. So I will just talk about some Kerala experiences which we had in past years and some general things and all. As all of you would know that Kerala, recent past, we had two major health challenges. One was Nipah outbreak and second was our unprecedented disaster, particularly floods, landslide and all which happened in Kerala in recent past. Nipah, I will say the outbreak, we were fortunate to detect it as early as possible, and this was also an example where government and private sector came together to identifying this thing and to take all the necessary action to control this epidemic. It was a doctor from a private hospital, Baby Memorial, who suspected that first index case to be of Nipah. Immediately Manipal sample was sent. It was informally confirmed from their side, but NIV Pune is the authority to confirm this type of virus, so again reconfirmation was taken from there. And after that, entire machinery geared up, Medical College Hospital, Calicut was made as a main point where all cases, affected cases will be treated. We made isolation facility, 100-bedded facility immediately there. That was also a good model of public-private support. Sufficient number of N95 mask, personal protection kit, everything was given there. Training to all the staff concerned, from doctors, paramedical staff, cleaning staff and all who were dealing with this thing. They were properly trained, they were given proper kits and all, personal protection kit and all. And I will say that it was managed in the best possible manner, given the facilities which were available and all. But those 2 months, I went to Calicut that time. Calicut, which is a very vibrant city and all, that was looking like that no one lives here, markets are almost closed, no one is seen on road, and that type of situation was there. And that was the time where airport people, security checking people, they will advise that if you are not doctor, you are not supposed to go to Calicut. That was the fear factor that time. But that was managed well. And that entire thing is properly being documented to circulate it to all the stakeholders so that lessons learned and all can be used in other places also. One big lesson was that infection control and particularly government sector hospital, tertiary care and all, many times overcrowding happens, bystanders and all, for one patient, 3-4 bystanders coming and all. So those are the areas where we are working, that this overcrowding and infection, hospital acquired infection, what type of steps can be taken. Second big learning for Kerala was this disaster time, our health preparedness and all. So there also, even our health team helped for many rescue operations also. Our health team members, they became the first respondent and all, and rescued people, even patients from hospitals and all, which were flooded. And even after disaster, normally this lepto outbreak or dengue, all these sites, even our field workers, everyone worked in a very much team spirit to control that after disaster, casualties and disease, this thing is as low as possible. Kerala, we know that other indicators, if we see maternal and child health, MMR side, we are the lowest in country. And despite that, in past 2 years, as per our latest SRS data, we made a 25% decline from figure of 61, we came down to 46. There also, in partnership with Kerala Federation of Obstetricians, we are targeting figure of 30 by 20 MMR figure, and we were targeting 20 figure by 30, which now Government of India is saying that Kerala should be targeting single digit MMR figure, and also we are working on that. Once we are achieving our 30 figure by 20, certainly we will be working out to bring our MMR in single digit. Similarly, IMR also, we were stagnant on 13 IMR figure for a long time. After that, a significant decline. As per latest SRS, our IMR is 10. And practically, at present, our data shows that we should be anything in between 8 to 9. We are waiting for the next SRS. Then we have taken a step like Hridayam program, that each and every child where congenital heart disease is there, operation or any procedure is required and all, identifying them early and providing them treatment in government sector or impaneled private hospital free of cost, so that there is no out-of-pocket expenditure for the parents. We leveraged Government of India side Rashtriya Bal Swasthya Karyakram and state government Arogya Kiran program for that. And these are the areas where we are taking private sector totally on board, training program and all. We ensure at least 25 to 40% participation of private sector doctors, private sector paramedical staff and others also. Communicable disease also, we are working for this TB elimination. Then leprosy side again, we are taking leprosy case detection campaign, and also these things, even all these states are doing in routine manner. Kerala system also, though our numbers are low, but if numbers are low, you have to take more effort to bring it further down. Then Kerala, if we talk about health challenge, certainly non-communicable disease is our area of challenge which is further emerging. As we know that diabetes side, we are having around 18 plus age group, 1/4 population is diabetic. Hypertension, if we see, 18 plus age group, 1/3 of our population is having hypertension. Similarly, since diabetes and hypertension is there, so heart disease and other side also cases are increasing. Cancer is on rise. So these are the area of challenge where we are going to provide cath lab and other facility at district hospital level, dialysis center at taluk hospital level and all, and a lot of work from government funding, from other resources and all is going on. And similarly, geriatric care is another area where Kerala population is aging. So this is also one area where we have to take a lot of effort to ensure that each and every elderly person coming to hospital, he finds hospital friendly to him, ramp, then separate ward and all other things are provided to him, and these type of things. And Kerala government has taken one big initiative, Ardhram, that is health sector transformation and making it patient friendly. So out of our 841 PSC, 170 PSC we targeted to make them family health center, guideline and all the manuals were prepared for that. And basically point was that PSC which were working till afternoon, they should be functional till evening 6 PM. And instead of one doctor, 3 doctors should be there, 4 staff nurse, then similarly paramedical staff and all sufficient number should be there. I think that is helping us a lot. Many people who couldn't afford private sector out-of-pocket expenditure, but they were forced to go to private sector since afternoon and all, they were not having option. They are returning to government sector, and we are seeing a significant increase in OP, particularly in primary healthcare level in government sector. So similarly, quality also, our CEO, National Board of Accreditation told about NABH journey and all. Initially, I think 5 or 6 hospitals in Kerala, government sector also we have gone for NABH. Now Health Ministry has come with National Quality Assurance Standard. So around 14 hospitals we got National Quality Accreditation in past year. And 2 hospitals, one our Taluk Hospital Chalkudi, which was devastated by floods very badly. Just before disaster, national team assessed that, and that scored highest mark in sub-district hospital level in country, that was 98% mark. And one of our family health center in Wayanad district, tribal family health center I will say, that scored highest mark in PHC level in country. So quality side also we are focusing that any patient coming to government facility should not feel that quality is lesser than any private facility. And target is that any patient which cannot afford private sector fee and other things, he must have good quality healthcare in government sector. So even Kerala side, another point that we are trying to leverage Ayush also. We are having a strong base of Ayurveda. So using that for NCD, prevention and promotive activity and all, we are working on a big way. Even integrating yoga for many of the lifestyle diseases, that side work is going on. So basically Kerala system, though it is a robust health system, but still we are having our own challenges and all, and we are continuously working on that. Certainly this type of workshop and this thing, I will say that even this School of Health Science can evaluate this family health center in these type of models. Certainly an outsider evaluation giving a different perspective that what further changes are required will be good for a state. So I think that this will be a continuous convergence and cooperation from TIS and our Kerala side health sector also. We will be engaging with some projects and all in future also. I wish all the best to this Health Odyssey workshop, Clairvoyance 2018, and I wish organizers and TIS Institute all the success. Thank you.
Thank you, sir, for the informative presentation of the great work you oversee in Kerala. I would now like to graciously invite our guest of honor, Mr. Sarvamitra Sharma, Founder, Chairman and Chief Advisor of Pehel Group and Advisor with the Jagran Group. Mr. Sharma is an accomplished industry leader and notable advocate for corporate social responsibility in our country. He is at the helm of Jagran Pehel, an organization actively involved in awareness generation and promotion of social development through innovative means of mass media approaches, utilizing the immense coverage of Jagran Prakashan Limited across 15 states with media in 5 languages. Their leading newspaper, Dainik Jagran, has over 7 crore readers as of 2017. With the goal of improving quality of life through self-dignity, community education, self-efficacy, and bringing about behavioral change for all-round development of society, Mr. Sharma's vision to develop a healthy and informed society focuses on collaborating with stakeholders at all levels to focus on initiatives such as education for all, health, hygiene and sanitation for all, gender equality, poverty alleviation, water conservation and environment protection. We are grateful to Mr. Sharma for taking the time to grace our event with his presence and hope our audience is inspired by his message and his tireless enthusiasm for the cause of humanity. I please welcome Mr. Sarvamitra Sharma to address our audience.
Friends, at the age of 75, if I am enthusiastic, you all give yourself a big hand. Said, this is my second year into coming here for deliverance. My friend is sitting here. He was sitting next to me last year. It's kind of a pilgrimage. I said last year also. I came way back when I was a director in Eastern Coalfield, one of the subsidiaries of Coal India, when the law for CSR being experimented, evolved and developed in this very premises of Tata Institute of Social Sciences, which I hold to be the alma mater for all good corporate social responsibility. It's really a proud honor for me to be here again and again. I consider this to be my privilege to have a pilgrimage, and I want it to be as much as I can. So my first thanks to all of you for providing me an opportunity to explain what I see as corporate social responsibility. I am not an expert on the subject of health, hygiene, except the fact that I want to live a healthy life. That's the only relationship I have with health. So I believe individual social responsibility. Young persons should understand we all are, corporate can wait. Let us start with ourselves. Our first responsibility is to keep ourselves healthy. And how can we be healthy? We can be healthy by eating good food, that is nutrition food. How can we be healthy? By keeping personal hygiene. How can we be happy? By having community sanitation around us. Hand wash, which started my journey into CSR way back, 10 years back, made a drastic change. Healthcare, hospitals, accreditation, and the wonderful work my friend Mr. Kumar has done in Kerala is really very, very inspiring. I was requesting him to give me the details so that our 7 crore, 70 million people who read Dainik Jagran can come to really know about it. What kind of disaster management actually happened in Kerala. We get lost in political news, we get lost in all kinds of activities, but the real heroes, the champions are amongst you and amongst him who have really done a wonderful, wonderful job. And now, coming to the fact of my young persons, I may tell you, I have 2 daughters, one is a doctor and eye surgeon practicing in Lucknow, now whole time working in Vivekananda Eye Hospital, married to a doctor again, a general doctor too. Younger one is a chartered accountant, a student from Indian Law School, Pune, and now working with Deloitte. And my son-in-law, who was in the army, left the army and found better pastures, and now he is working with Amazon as the country pathway manager. I am a happy man. I lost my wife about 6 years back. But that was a loss which made me more committed towards CSR, individual social responsibility. My friend is sitting here, he saw a little bit of darker side in me, but then that's how a human we are. And I trust all of you to be committing and rededicating yourself for the good work which is lying for all of us. If we want our country to be strong, which we all want actually, then we must promise ourselves a healthy, happy, hygienic, sanitation India. With these words, I will rest myself, and I like to not to be depriving you from the intelligent panel discussions which I also like to learn. Thank you very much. Thank you.
Thank you, Mr. Sharma, for such an inspiring and persuasive address. We are sure everyone appreciates your efforts and vision with Jagran Pahal. We are grateful for your presence as guest of honor at Clairvoyance and are confident your tenacity, zeal, and commitment to the great cause of positive social development set alight the flames under this crucible for ideas and experiences we call clairvoyance.
I would now like to request Professor Bharat to please felicitate our guest of honor. With a ceremonial shawl, a bouquet, and a small memento from all of us. I would request the audience to give a huge round of applause. I now request our Dean to please felicitate our esteemed chief guest, Shri Keshavendra Kumar and Dr. Harish Nadkarni. I now request our students to please felicitate our very own Professor Shalini Bharat. I request Dean Sir to please felicitate our second chief guest, Shri Keshavendra Kumar. I request our students to please felicitate our very own Dean Sir. Thank you everyone for a big start of clairvoyance ceremony. Now we move over to the academic sessions. I please request the dignitaries to please take their seats.